Okay, once again we are going to talk about dementia from Wikipedia, the free encyclopedia. In this lesson we will talk about the management of dementia. In our previous class 6.1, psychological and psychosocial therapies has been discussed. So now we are going to discuss medications as a type of management to dementia. So without wasting our time, let's enjoy our reading and let's enjoy listening to the medications as a way of management to dementia. I want to tell you this is also going to be a little bit long video, and I do hope you will continue having patience until the video is over. Okay. Medications, this you can see at the beginning of our video. This is the structure of the medications used for reduction or management of dementia. The name of the medicine is donepezil. No medications have been shown to prevent or cure dementia. Medications may be used to treat the behavioral and cognitive symptoms, but have no effect on the underlying disease process. So this is acetylcholinesterase inhibitors such as donepezil may be useful for Alzheimer's disease, Parkinson's disease dementia, DLB, or vascular dementia. The quality of the evidence is poor and the benefit is small. No difference has been shown between the agents in this family. In a minority of people, side effects include a slow heart rate and fainting. Rivastigmine is recommended for treating symptoms in Parkinson's disease dementia. Before prescribing antipsychotic medication in the elderly, an assessment for an underlying cause of the behavior is needed. Severe and life-threatening reactions occur in almost half of people with DLB and can be fatal after a single dose. People with Lewy body dementias who take neuroleptics are at risk for neuroleptic malignant syndrome, a life-threatening illness. Extreme caution is required in the use of antipsychotic medication in people with DLB because of their sensitivity to these agents. Antipsychotic drugs are used to treat dementia only if non-drug therapies have been used and the person's actions threaten themselves or others. Aggressive behavior changes are sometimes the result of other solvable problems that could make treatment with antipsychotics unnecessary. Because people with dementia can be aggressive, resistant to their treatment, and otherwise disruptive, sometimes antipsychotic drugs are considered as a therapy in response. These drugs have risky adverse effects, including increasing the person's chance of stroke and death. Given these adverse effects and small benefits, antipsychotics are avoided whenever possible. Generally, stopping antipsychotics for people with dementia does not cause problems, even in those who have been on them a long time. N-methyl D-aspartate NMDA receptor blockers such as memantine. Memantine may be of benefit, but the evidence is less conclusive than for ACSEIS. Due to their differing mechanisms of action, memantine and cholinesterase inhibitors can be used in combination, however, the benefit is slight. An extract of ginkgo biloba, known as EZB761, has been widely used for treating mild to moderate dementia and other neuropsychiatric disorders. Its use is approved throughout Europe. The World Federation of Biological Psychiatry guidelines list EZB761 with the same weight of evidence level B given to acetylcholinesterase inhibitors and memantine. EZB761 is the only one that showed improvement of symptoms in both AD and vascular dementia. EZB761 is seen as being able to play an important role either on its own or as an add-on, particularly when other therapies prove ineffective. EZB761 is seen to be neuroprotective. It is a free radical scavenger, improves mitochondrial function, and modulates serotonin and dopamine levels. Many studies of its use in mild to moderate dementia have shown it to significantly improve cognitive function, activities of daily living, neuropsychiatric symptoms, and quality of life. However, its use has not been shown to prevent the progression of dementia. While depression is frequently associated with dementia, the use of antidepressants such as selective serotonin reuptake inhibitors, SSRIs, do not appear to affect outcomes. However, the SSRIs, sertraline and citalopram, have been demonstrated to reduce symptoms of agitation compared to placebo. The use of medications to alleviate sleep disturbances that people with dementia often experience has not been well researched. Even for medications that are commonly prescribed, in 2012, the American Geriatric Society recommended that benzodiazepines such as diazepam and non-benzodiazepine hypnotics be avoided for people with dementia due to the risks of increased cognitive impairments and falls. Benzodiazepines are also known to promote delirium. Additionally, little evidence supports the effectiveness of benzodiazepines in this population. No clear evidence shows that melatonin or ramiltion improves sleep for people with dementia due to Alzheimer's. But it is used to treat REM, sleep behavior disorder, in dementia with Lewy bodies. Limited evidence suggests that a low dose of trazodone may improve sleep. However, more research is needed. No solid evidence indicates that folate or vitamin B12 improves outcomes in those with cognitive problems. Statins have no benefit in dementia. Medications for other health conditions may need to be managed differently for a person who has a dementia diagnosis. It is unclear whether blood pressure medication and dementia are linked. People may experience an increase in cardiovascular related events if these medications are withdrawn. The medication appropriateness tool for comorbid health conditions in dementia, MATCAD, criteria can help identify ways that a diagnosis of dementia changes medication management for other health conditions. These criteria were developed because people with dementia live with an average of 5 other chronic diseases which are often managed with medications. Thank you. That's all for the time being. And once again, I'd like to repeat this sentence. These criteria were developed because people with dementia live with an average of 5 other chronic diseases, which are often managed with medications. So I would like to thank you, and I would like to always appreciate any endeavor, any trial from you to be a part of the channel by subscribing to it, by liking, by commenting, and I do hope you have enjoyed reading and you have enjoyed listening to this video on the management of dementia. Especially medication is a type of management of dementia, and I have already done the reading on dementia, and I'd like to thank you very much. Thank you.